No doubt you're probably familiar with the role of vitamin D in promoting healthy bones, largely by promoting the absorption of calcium. But recent and mounting evidence shows that a vitamin D deficiency can lead to an increased risk of type 1 diabetes, muscle and bone pain, and even more serious, cancers of the breast, prostate, ovaries, colon, esophagus, and the lymphatic system. Vitamin D prevents rickets in children and osteomalacia in adults. Rickets causes skeletal deformities, and osteomalacia causes muscular weakness and weak bones. Your doctor may also recommend vitamin D to help lower your blood pressure or your chance of heart attack, rheumatoid arthritis, or MS.
Vitamin D helps to promote healthy bone and tooth development. It also helps us to absorb calcium into the bloodstream, which is important for maintenance of bone health. It also helps to prevent osteoporosis. What's interesting about vitamin D is that the skin can produce its own source of vitamin D with exposure to sunlight. However, we're concerned about skin cancer, and so wearing sunscreen prevents us from producing our own vitamin D.
Vitamin D, also called calciferol, is a vitamin that dissolves in the body's fat. The major biologic function of vitamin D is to maintain normal blood levels of calcium and phosphorus. While calcium makes up your bones and keeps them strong, phosphorus helps maintain good teeth and bones and keeps muscles and nerves working properly. Vitamin D is found in food, but can also be made in your body after exposure to ultraviolet rays from the sun. During the 1930s, a milk fortification program was implemented to fight a rickets epidemic. Today, nearly 98 to 99% of milk is fortified with vitamin D in our country. However, milk derivatives such as cheese and ice creams are not fortified as it is with milk, and consequently, these products contain only a small amount of vitamin D in it. There are wide varieties of natural foods that contain vitamin D. These are cod liver oil, salmon, mackerel, tuna fish, sardines, egg, beef liver, and many others. We can easily obtain vitamin D from cheese and pudding, provided it has been prepared with fortified milk. Sun exposure may be the most important natural source of vitamin D. Ultraviolet rays from the sun, as little as 15 minutes per day, activate the synthesis of vitamin D in our skin area. However, adequate exposure is seemingly difficult to define. Several factors determine how much sunlight we require to adequately synthesize vitamin D: where we live, the season of the year, our skin type, and sunscreen usage. While sunscreen protects the skin from harmful UV rays, it also blocks production of vitamin D. The American Dietetics Association, or ADA, states that sun exposure to hands, arms, and face for 5 to 15 minutes per day is believed to be adequate to provide sufficient amounts of vitamin D. However, more sun exposure may be needed during the winter months, especially in northern latitudes and places with a lot of smog. Studies indicate that people with dark skin need as much as 6 times more sunlight than those with light skin to reach the same blood level of vitamin D. Conversely, too much exposure to ultraviolet light may result in skin diseases, so moderation is key. Nutrient recommendations suggest that 200 IU, international units, for children and 400 IU for adults, although reports vary as to the exact requirement. Elderly people require higher doses, between 400 and 800 IU, and commonly most of this needs to come from a supplement, since many have restricted diets and sun exposure. In general, only individuals at risk for osteoporosis or other related conditions would require higher intakes of vitamin D. This includes smokers, heavy drinkers, people lacking dairy products, or ones not eating a balanced diet, as well as individuals with a genetic predisposition to the disease. Vitamin D deficiency can occur for a number of reasons. You follow a strict vegetarian diet. Most natural sources of vitamin D are animal-based, including fish and fish oils, egg yolks, cheese, and beef liver. Your exposure to sunlight is limited. You have dark skin. The pigment melanin reduces the skin's ability to make vitamin D in response to sunlight exposure. Your kidneys cannot convert vitamin D to its active form. As people age, their kidneys are less able to convert vitamin D to its active form. Your digestive tract cannot adequately absorb vitamin D. Certain medical problems, including Crohn's disease, cystic fibrosis, and celiac disease can affect your intestine's ability to absorb vitamin D from the food you eat. You are obese. Vitamin D is extracted from the body by fat cells, altering its release into the circulation. People with a body mass index of 30 or greater often have low blood levels of vitamin D. If you fall into one or more of these categories, you may have to use vitamin D supplements to get it into your body. Unlike some other vitamins, too much vitamin D can cause symptoms such as nausea, vomiting, poor appetite, constipation, weakness, bone pain, and weight loss. It can also cause kidney stones, calcification of soft tissue, and raise blood levels of calcium. High blood levels of calcium causes confusion and heart rhythm abnormalities.
Vitamin D is a hot topic right now because we're finding more benefits of it in the research. There are vitamin D receptors all over the body, and we find in the research it may have benefits in reducing heart disease rates and preventing certain kinds of cancer. It's interesting to note that the dietary reference intake, or the requirements for vitamin D, are anywhere from 200 to 600 international units. Most of the research is focusing on a dose between 1,000 and 2,000 international units.
Additionally, it's true supplements may be necessary for some people. For the majority of the population, daily sun exposure is not only sufficient, but also the most efficient way of obtaining vitamin D. However, monitor your exposure because ultraviolet rays are linked to skin cancer. Remember, 10 to 15 minutes of exposure per day is adequate. Everything in moderation.